Hello, today you will learn fun facts about medical masks. Currently, not a single medical professional can do without a medical mask. Previously, the mask was used only when performing some manipulations, but the situation in the world has introduced masks into everyday life and work. Even in ancient times, the effectiveness of the use of masks was proven, and its new types and forms developed by scientists only confirm this. Availability and inexpensive cost are also pleasant bonuses. For a long time, masks were only reusable and were made of multi-layer gauze since the material is cheap and tolerates different types of disinfection and sterilization well. For better protection of a person from the smallest viral particles, manufacturers have come up with the idea of treating masks with disinfectant solutions. Long-term wearing of the mask outdoors reduces its effectiveness since dust remains in the fabric and impairs its protective properties. In psychiatric wards, masks often save doctors from spitting patients. The very first medical mask is considered to be a plague doctor mask with a beak. The doctors of that time believed that if medicinal plants were placed in such a beak, then the air passing through them would be filtered and cleaned of bacteria and viruses. Although reusable masks can be sterilized, only disposable masks are used in surgical practice. Masks are an excellent way to protect yourself from disease, but the use of respirators increases the level of protection severalfold. One can celebrate the centenary of the use of masks. Their mandatory use was introduced by the Ministry of Health back in the 20s of the last century. Previously, masks were used universal. Now on the shelves in pharmacies you can find masks of different shapes and sizes. Large masks for adults and smaller masks for children are usually available. In the operating room, the patient's biological fluids can enter the surgeon's mask, therefore such masks are usually impregnated with a special solution so that the mask does not soak and repels liquids. Of course, wearing a mask protects a person from contracting various diseases, but it does not provide 100% protection. The protective properties of a medical mask help not only to protect a person from bacteria and environmental viruses, but also conversely prevent a sick person from spreading germs. Some viruses can cause disease by getting on the mucous membranes, so the protection of the mucous membranes in the nose and mouth may not be enough. In such cases, eye shields can be used. The duration of protection that the mask provides depends on what material it is made of, what it is impregnated with, and what conditions it is used. Therefore, there is no exact recommended time for all masks. Read this on the manufacturer's packaging. Even the use of a mask allows air to pass into the respiratory tract of a person, thereby dust can enter the respiratory tract. Because the mask does not fit snugly to the face. But most of the unwanted substances remain outside the mask. If the information was useful to you, you can like and subscribe to the channel. See you soon.